Good evening, guys. We see our first two live viewers are up. Good evening, ref underscore doctor. Good evening, Vuyelwa 583. Thank you so much for joining our live. Hope to have a nice interactive session with you guys. So we're just waiting for the two other colleagues to join, and then we'll proceed with our live and we'll give you guys more info. So just hang in there, we're about to start. Yeah, so guys, are you aware what month are we commemorating today? This entire month actually. Let me see if I can get some interaction with our two followers so long. And guys, please feel free to drop your questions or comments, and then we'll answer and revert back to you. So we'd like to have a nice interactive session. Yes. Sister Mvandaba, it's you. Obvious. Okay, our first one is about to join. Just hang in there. Monica, welcome. We're just waiting for your picture to show.
Oh, okay. I can see myself from here, but I can't see you on the other side.
Oh, you can't see us.
But I can see myself.
And I can hear you. Just a pity that your picture is not coming through here. But you can rejoin to just see if
Okay.
we can't connect properly.
Okay. All right.
Thanks, Monica. So yes, colleagues, we're waiting for two of our colleagues to join us. Our two panelists will be joining us shortly, and then we will proceed with the proceedings of the night, where tonight we'll be discussing all things TB. So please feel free to share your questions, comments, and let us know of any lived experiences that you guys have with TB that you guys can share. So we're just waiting for our first one's about to join. Welcome, Miss Lute. We see you, ma'am. Welcome, underscore simply SG underscore. We see you. Please get your questions on standby for us. We are about to go live. And the nice thing about tonight's one is that we've got a special guest from National Department of Health. There she comes. Welcome, Monica. How are you?
Thanks, Natty.
Are you good?
Yes, I'm good. I can't complain.
No, that's awesome. So, Monica, we are live and we are no longer testing. But
That's great. Good to
yeah,
know.
so we are waiting just for Mr. Blar to join us, and we have a few online viewers already. So we've just asked them to kindly be patient, exercise patience with us. As soon as Mr. Blar starts, then we can start the proceedings. So is it fine with you on your side? Good. Yes. So colleagues, yes, for online viewers, please jot down your questions for us, your comment. We'd love to also hear some or read stories that you guys have to share with us and the others that will also be joining the live in terms of lived experiences that you guys know of that you want to share with us. And we'll be sharing also some good insights and what we as Provincial Department of Health together with National Department of Health will conducting. So yeah, Monica, I think we can so long interact with our followers as we wait for Mr. Blar to join. Colleagues, then let me not waste time and let me just introduce to our viewers our first panelist who has joined. She goes by the name of Monica Longwe. She will properly introduce herself to which organization she represents and what work she does there. So over to you, Ms. Longwe.
Thanks, Nati. My name is Monica Longwe. I am the Social and Behavior Change Communications Lead. I'm actually sitting in the National Department of Health as a technical lead, providing support on all TB communications on the NTB campaign. And I hope that you've heard about it. So that's what we'll be talking about. Thanks, Nati, for having me here. And I look forward to the interactions.
That's great. That's great. Thank you so much for that brief introduction, Monica. I think it's key and pertinent that our followers, have a very strong understanding of the work we do, especially from national cascading down right to province. And one interesting point would be, expanding on SPCC the work we are also envisioning on doing. So I saw a first question. There was a question that from one of our viewers. Yeah, what is the difference between TB infection and TB disease? So, colleagues, we will definitely answer all questions. Please keep them coming. We are noting them as we go along. And then we'd want to do one thing and answer all your questions as we move on. So we're just trying to get our last panelist to join, but I think without wasting time, we can actually start, Monica. So without wasting further ado, let me just give a warm welcome to everyone, our viewers, and a warm welcome to yourself, Monica. And
thank you.
Let me just give the viewers a brief introduction. So TB, or tuberculosis as it's known, it remains one of the most pressing public health challenges in South Africa currently. And South Africa remains on the top 3 list of 30 high burden countries for TB associated and drug resistant TB. And we account for a significant share of the global TB epidemic. So in 2023, there was an estimated 270,000 people who developed TB, including 13,000 which amounted to 5% with DRT. So additionally to that, more than half of the notified TB patients were co-infected with HIV, highlighting the integrated response to both epidemics. So Monica mentioned something key when it comes to SBCC. So I'm sure she will be touching a lot on that, on our integrated response to both epidemics. So South Africa has made notable progress in controlling TB. So since 2015, our TB incidence rate has declined by 57% and has increased 10%. But however, TB-related deaths have only declined by a small margin of 16%. And over half, 56% of TB-affected households still face catastrophic costs in accessing proper quality health care. So these disparities highlight the urgent need for improved treatment success, better financial protection, and a stronger community-based support mechanism. So without further ado, with giving that background, I think it's important for us then to go right into the nick of things. And Monica, can you please expand a bit? What is SBCC before we delve into the thick of things?
All right, thank you so much. So I'll talk about SBCC in general, and then I'll talk about SBCC TB specific SBCC. So in general, SBCC is not just an activity. So it's social and behavior change communication. The keywords are social and behavior change. So when we talk about behavior change, we are trying to change the behaviors of people. It's not just one activity. So you realize that campaigns in the past have focused on just giving information. You print flyers, you print posters, and you give people information. But what do we want people to do with that information? We want people to act on it. If we're asking people to go for a taste, we want to go for a taste. But what social and behavior change communication does is to actually make sure that we are coining messages in a way that motivates people to act on the behaviors that we're trying to change. So it's a set of activities that try to work on motivating the people to do what we want them to do, but also giving them enough information so that they can make decisions, whether to act on it or to not. So at the end of the day, we hope that they can actually act on it. So that's essentially what behavior change is all about. And there are so many strategies that are employed in behavior change. Communication, information sharing is one of them. But information sharing only cannot change behaviors. That's why we also try to look at other strategies, like what are we doing in the communities? If someone gets a flyer on the road, they'll go home, and then what's happening at home? What's happening in the facilities? What's happening in the communities? There's stigma there. They might even just throw it away, thinking, oh, if someone sees me holding this TB brochure, they'll think that I have TB as well. Let me not. So we are just trying to look at the different levels. So at the individual level, what messages are we giving? At the community level, what messages are we giving? And what interventions or strategies are we implementing? At the policy level, at the family level. So SBCC is a complete process of trying to change behaviors. That's in general. Should I go on to talk about TB SBCC, Nati?
We'll go into that one. Thank you so much for that introduction. I think you on very key important points there. We are dealing with patient attitude, patient outlook in terms of how they see their own healthcare and the responsibility they have towards it. And ours is to influence them positively to take charge of their health. So thank you so much, Monica, for that. We will enter into the second part of SBCC focusing on TB. And also take to welcome our esteemed TB champion of the province, goes by the name of Vincent Blar. He is our acting team provincial manager. He can also just briefly say hi and just introduce himself.
Good evening, Screamers. Good evening, fellow Pelon members. And thank you for having me on this live Insta live session on TB. Thank you, Nati.
Thank you so much, Mr. B. Mr. B, we have our viewers online, and we've asked them to jot some few questions for us as we go about our live. But we will respond to them as soon as we have done giving a brief breakdown of what our role as the department, both national and provincial, is with regards to combating and ending TB. So, into the thick of things, Mr. B. For a lay person, what is TB?
No, thank you very much, Nati. So to the communities out there and the viewers, TB is a disease that is caused by the organism called Mycobacterium tuberculosis. It gets spread from one infected person to another. TB is usually found in the lungs, but it can affect any part of the body. So we most prominently find it in the lungs, which we call pulmonary TB, but it can be found in any part of the body, which we can define as extrapulmonary TB. It is an infectious disease, but it is also preventable and curable at the same time when you take your treatment as prescribed by the nurse or the doctor or your community health worker who is overseeing your treatment. Thank you, Nati.
Thank you so much for that. There we have it, viewers, our viewers. It's important for us to know the disease that we are dealing with, and it has a name, and we do not have to be afraid of that disease anymore, as there are interventions in place. That national and provincial Department of Health has put in place in terms of access to healthcare and facilities that provide those services. So this month we are commemorating TB. It's called World TB Month. So internationally, it's known as World TB Month, the month of March. And on the 24th, we commemorated. And National will be having a nice commemoration that's taking place in Cape Town for this year. So, just to on what TB SBCC is all about. Can you then just delve a bit into that before we go into what National Department as well is doing in terms of advocacy as well?
Okay, no, thanks a lot. I think I'm going to talk about TB SBCC in the context of the national efforts as well. I hope that I'm not jumping the gun, but I just want to say that the National Department of Health has got a very comprehensive plan that it's implementing, a TB national plan, which we call the TB Recovery Plan. And when I talk about TB SBCC, I will be talking about it as part of the comprehensive strategy that the National Department of Health is implementing alongside the provinces. So we've got 5 pillars for the national TB program across the provinces. And yes, Mr. Blas? Okay, no. I thought he was talking. So we've got okay, no, thanks. So we've got 5 pillars that form part of the plan for the TB program. The first pillar, which is where the TB social and behavior change communication sits, is to communicate. The mandate there is to actually make sure that we are prioritizing TB as a national problem. We want people to know that TB is a priority and everyone should play a part in the fight against TB. So that is pillar 1, which is to communicate, which is where I sit and Nati sits. We are trying to make sure that all of you know that TB is a problem. And then there are other pillars, programmatic pillars. There are 3 pillars, which is TB case finding. So it's strengthening case finding, which is TB tasting. We want people to taste. Once people taste, we want them to get on treatment. That's the next pillar. When they get on treatment, we want them to stay on treatment until they are treated, they are completely cured of the disease. That's pillar 3. And then the other pillar is prevention. We want to prevent before we actually get to the disease itself. So there are also efforts that are being done to prevent TB. Our role as TB-SPCC is to actually make sure that people know how to prevent it. And then there's the fifth pillar, which is to monitor the interventions, whether it's communications, whether it's service delivery. That pillar is looking at how do we know that we are achieving our goals and targets. How does success look like? So pillar one, focusing on pillar one, what we've done on that one is because now we are implementing the End TB campaign, which you can see the beautiful background where Nati is, the green background. That is the End TB campaign. And that all is pillar one. And it's a platform where all TB communications are being communicated through. So we have actually developed a strategy that provides guidance on what needs to be done for us to fight TB. Like I said, what we're trying, like Nati said, that what we're trying to do is to change attitudes, to increase knowledge, to get people to taste. Where are they going to taste? How is tasting being done? So that is all that is happening there. So we have a strategy guiding that, and so that everyone, all the provinces know what we're supposed to be doing. And then we also have a social media campaign. You might have seen on the platforms, whether it's on the provincial platforms or it's on the national department. And if you're not following these platforms, especially maybe the National Department of Health, please follow. You'll find a lot of messages that are being shared both at the national and at the provincial level. So we have rolled out a social media campaign where we're trying to make sure that messages are getting out there. I saw a comment that said that there's a TB survivor here. That's great, because we've got a platform for you as well on pillar one of our strategy. We have got My TB Story, which is very exciting. And I think that's the one thing, if I was just to go back, and if I were to talk about one thing and go back, that would be it. We've got a platform which is called My TB Story. And if you haven't seen it, it's on www.mytbstory.co.za. If you type that in your web page, it will take you to the platform. So if you've had TB before, if you survived TB, if you're a champion for TB, you are requested to submit your stories on the page so that your story can inspire other people who have TB. Because somewhere out there, there's someone who's just been diagnosed of TB, and they feel like it's a death sentence. They don't know what to do. They're like, okay, so what now? Is there treatment for it? You know, or maybe they may be told at the facility, but they just don't have hope. So what we want is people who've just been diagnosed to go on that platform, to listen to those stories of the people who've been there, and to find some hope that they will be fine. So those are some of the things that we're doing, the interventions. There's quite a lot, but I'm not gonna go into it. I just wanted to talk about these two things, the social media and the My TB Story, because I think that those are the two exciting things that we're currently pushing. Over, Nati. No, if you want me to add, I'll add.
No. We don't want to give out everything just yet. We still want to entice them and hold them as part of our viewers. We've got a few questions coming up, but let me just give Mr. Blaar also a chance. Mr. Blaar, Monica mentioned the 5 pillars, and he mentioned the non-strategies in terms of addressing those 5 pillars, which is key. But now, going hand in hand with those non-clinical strategies, what are the clinical strategies that are in place to assist and address the 5 pillars? I'm sure particularly the clinical one will start perhaps from pillar 2 right up until the last pillar 5.
Pillar 4.
No, thank you so much, Nati, because it's critical that as much as the pillar 1 will create the demand for the testing, the services must be ready to accept the numbers that will flock into our facilities. And we want to assure our viewers that the system is ready for everyone who needs and requires a TB test, you can go to any public health facility and you can access a TB test for free. So we will be able to give you the necessary information, provide you with a screening, and if you answer affirmatively to one of the 4 screening questions, then we'll do the TB investigation by collecting your sputum, and then we process it going forward. The clinician will also advise you as to when to return for your results. Can I take this opportunity as well to get in the part of our viewers and public out there, providing us with current cell phone numbers? We need those numbers so that we can up our SMS notification as well. We have recognized that as a province and as a country, we have not reached our 60% target because our patients do not present to the facilities with these current cell numbers. Secondly, is that TB, like Monica said, it's not a death sentence. Because TB is curable. You take your treatment for 6 months as prescribed by the healthcare provider, you should be good to go. But we know that there are those patients of ours that after having initiated on treatment, they start to feel better and they want to now stop drinking their medication. We are urging them. That is not a good idea because we are running a risk of developing drug-resistant TB. And we don't want to enter into that space. That is why we are encouraging them to do the right thing the first time around, which is when you are on treatment, take your treatment as prescribed at the same time so that the treatment can work and kill the TB bacilli. And we then provide you with an outcome of either treatment cured or treatment completed. So we will be monitoring you over the journey of 6 months, where we also need to go to pillar 4, which is to prevent and prepare. So we need to screen your contact. So everybody that you got into contact with needs to be screened to protect the broader community from acquiring the TB disease, because we need to know what is the extent of TB in our communities, and making sure that after we have screened everybody that you came into contact with as a TB index person, we then also provide them with the necessary treatment. If we have ruled out active TB, we put you on TB preventive therapy. We've got various regimens, and the most famous one is a shorter regimen where you get 1 pill per week for 3 months, which is a TB preventive therapy consisting of rifampicin and isoniazid. So that is shown to be the most effective of the regimen. But we are also saying there are other regimens of TB preventive therapy that our people can access if they are not eligible for the shorter regimen, which includes, if at all you are living with HIV, you can then get a INH-based regimen for 12 months to protect you from acquiring active TB. Thank you very much, Nati.
No, thank you so much, Mr. Blaar, for that explanation. So we can quickly get into the questions that have been forwarded. Let me get with I think it's Ms. Lute. I know the handle, but I don't know how to say it. What are the reasons why patients are not adhering to treatment, and how can households and communities support government efforts? Mr. B, perhaps you can take us through that in terms of treatment adherence. And then maybe to Monica, our efforts in terms of addressing, stigma related to treatments, not to patients not adhering to treatment. What steps are we taking to ensure that we are addressing and reducing stigma-related issues? Let me start with Mr. Blaar, and then Monica, you can follow after.
So thank you so much, Nati, again for that question, and thank you, viewers, again. Please engage further with these questions. So patients will raise various reasons. So we've got patient-related factors and system-related factors. When we deal with patient-related factors, we might find that the patient is experiencing adverse events and is not able to report this to the healthcare provider, then it makes the patient despondent to continue taking their treatment. That can be one factor. The second factor could be the patient might just be malnourished, which is also going to affect the absorption of the medication. That is why our intervention now as government is to make sure that we refer such patients who are malnourished with a body mass index of less than 18.5 to our dietitians, because in the Department of Health, we treat the patient in totality. So we'll be able to refer to the multidisciplinary team consisting of a nutritionist or a dietitian, where we can assist with the optimization of nutritional status of our patients. The third issue that might occur is that the patient feels better after 2 months. Remember, anti-TB treatment is very potent. So it fights that bacilli within no time. And the patient starts to feel better. And then the notion would be, now that I feel better, I should not continue my treatment. But we are urging our patients. That is where we make the biggest mistake, because there's actually now the phase where we need to fight off the bacilli that wants to regrow in the next 4 months. So the medication that we will be providing you will be medication that will fight this bacilli that wants to regrow, to get you better and to ensure that we achieve either you being treatment completed or cured. So those are the patient factors. System factors might just be that the patient stays a little bit far from the facility, which means access to TB care is impeded. The patient suffers from catastrophic costs in that they need now to spend a lot of money to access TB care. So we have decentralized our services with the extension of our community health workers to make sure that DOT happens at the household, because we have trained our community health workers to make sure that they can oversee that process so that the patient can be treatment cured or successfully treated, so that we can minimize the spread of TB in our communities. Thank you so much, Nati.
Oh, thank you so much for that brief explanation. But I think it will assist in terms of even changing our methods to why we need to adhere to our treatment and the type of regimens that are available. Thank you so much, Mr. Black. Monica, let me bring you right into that in terms of how are we addressing the stigma-related issues, because we see a lot of loss to follow-ups, we see a lot of non-adherence to treatment clients. So what can SBCC, or how can SBCC assist in terms of addressing stigma?
Yeah, thank you very much. So in driving the TB communications and all SBCC related interventions, we are guided by, we are trying to do it as systematically as possible. As you can see from what Mr. Blah has said, the systems are multi-level. I mean, the problems are multi-level across the system. So we have essentially, when we looked at the SBCC, we said, you know what, we need to have interventions at the multiple levels. So we use what we call the socio-ecological model, which is, it looks at all the levels at which the patient interacts. So at the individual level, if you're looking at a patient who's been diagnosed, there are factors that may limit them not to complete the treatment. And maybe that could be they're lacking enough information. That could be because maybe they just don't understand, or maybe the counseling at the system level. At all levels, there are going to be patient level factors and then system level factors. So what SBCC is currently doing is, if they don't have enough information, we are trying to get as much information out there. So we are sending out messages via social media. We are doing the community activations and everything. And then maybe at the family level, they've been given treatment. They need food, but there's no income at the family level. There's no food and everything. How does SBCC then come in? So SBCC is not just giving information. This is the point where we try to look at how do we partner with private sector? Can we talk to Pick and Pay? Can we talk to all these retailers to support us? you know? So that's part of SPCC. At the family level, how can we do it? But we also need to make sure that we are motivating the family members to support. If it's about food, you build partnerships. If it's about information or motivation, you try to send out messages there to get the families. At the community level, there's stigma. People don't want to be known that they've got TB because, and Nati, you did highlight that I should talk about TB and HIV. Mostly it's because when people have been diagnosed with TB, people tend to think that if you've got TB, then you've got HIV. And we all know the stigma attached to HIV. So there's also a stigma operating at that level. How do we address that? So we are also trying to set up support groups. We are trying to get the patients themselves to initiate communities, what we're calling the TB Champions program, which is what we want all the provinces to keep implementing. I know that there's been programs like that in other, like in HIV, where the patients drive these interventions to make sure that they are gathering the communities, telling them that, you know, this is not a death sentence. Look at me. I'm healthy. I'm thriving. I survived. You too can survive. So that will kill the stigma. I'm just giving examples. There are a few other, there are religious beliefs, there are cultural beliefs, all those things. We are working with the religious leaders to give them messages. We have also trained traditional healers. We have only started in Gauteng. We will be training traditional healers across the provinces to get them involved so that stigma is reduced. The people are getting tested. People are getting on treatment and just supporting the patient. At the policy level, that's where I am. We're also trying to translate the policies into practical tools that healthcare workers can use at the facility. For example, right now we are translating the treatment adherence policy, which is a huge document. No one in the facility will sit down and start looking at what do we do now. So we're trying to make sure that we take the critical components from that policy, we put it in a flip chart, so that when the healthcare worker, when the doctor, the nurse, the clinician is sitting here with a patient, they should know what to do. How do we take the patient through that? That is addressing a system level issue, which is maybe the quality of counseling. So in a nutshell, we are trying to address all the factors from the patient level side, while there's quality improvement activities that are also happening. But on SPCC, this is what we're doing. Thank you.
Oh, thank you so much, Monica, for that wonderful explanation in terms of how we reduce stigma. It is an ongoing concern, and it is still a challenge within communities, because you get stigma from, you experience stigma from the community, and you even experience self-stigma, where you stigmatize yourself for being infected either of or co-infected of TB and HIV related diseases. But it's so assuring to know that we have systems in place, and that the department, national and provincial, are working tirelessly to develop policies and implement those policies in terms of the work they're doing. So it will lead me to my next question for you, Mr. Bra, with regards to our how is the burden of disease in the province, and what interventions do we need to put in place to address those areas that high in terms of TB burden, Mr. Bean?
No, thank you very much, Nati, for that question. So, colleagues and the viewers out there, Northern Cape has got one of the highest incidence rates of TB in the country. At last count, we were around 500 per 100,000 population. I think it's 577 per 100,000 population. So if you look at the burden itself in the province, we find Francisbaard being mostly affected, followed by ZF Mgcawu district. In third place is Pixley Kaseme. fourth place is JT Kaitiwi, and then lastly Namakwa. So in these districts with a high burden, we have already disseminated their targets to make sure that we increase testing, because in order for you to nip TB in the bud, you need to saturate testing in the localities. So for an example, if we focus on Francisbaard, we need to test at least 95% of the population of Francisbaard. In that fashion, we will know what is it that we are dealing with and how far in terms of the extent of TB. And then we can direct our interventions in those particular areas. I'm going to give a case in point. We know that in terms of the sub-districts, your municipalities, Sol Plaatje and Polokwane, are your highest sub-districts. So our focus should definitely then be zoomed into those two sub-districts. Just as an example, where we start from Pillar 1, making sure that we become accountable with Pillar 5 in terms of our monitoring and assessment of our interventions. So when we diagnose someone with TB, we need to link the patient to care. And at this juncture, as the Northern Cape, we have about 9,680 patients. About 1,600 of them are missing. Having been diagnosed with TB, we need to find them, put them on treatment, and making sure that we break the chain of transmission in the communities, because we are using treatment as a form of prevention. Thank you very much, Nati.
No, thank you so much, Mr. B, for that. Indeed, we have been provided an outlook in terms of what our work lies ahead in terms of burden of disease, Monica. So it means now the type of interventions that we also need in place will be systematic. So one of our viewers here asked a question in terms of how can our health-based care workers who are visiting households maybe be trained extensively on those pillars. So Mr. B, I think I can also bring you in terms of how the clinicians can be trained in terms of the right processes to follow when dealing with such a frail and fragile patients. How can the trainings available for our healthcare workers, clinicians at facility levels?
No, thank you, Nati. So our training is geared towards healthcare professionals, medical doctors, nurses, as well as our community health workers, because those people are our front line when it comes to service delivery in the communities. So we've got formal trainings that we conduct face-to-face for all these three categories. So we do that in our districts, depending on the demand, depending also on the available resources. The trainings are conducted in that fashion. So for an example, we might have 4 TB trainings in a financial year that will be allocated for medical doctors, nurses, and community health workers. Why it's critical that we have a capacitated health workforce as one of our WHO building blocks, because when the healthcare workforce is capacitated, we know that they are going to be able to render quality care to our patients. So we can reassure the viewers and the public out there that our healthcare workers are receiving capacity building on an annual basis to make sure that they are also up to speed with the latest developments. Remember, TB and HIV are very dynamic programs. So updates are happening quite frequently, and it's our responsibility to make sure that we bring our healthcare workers up to speed. Thank you, Nati.
Monica, please go ahead.
Sorry, can I add?
Yes, please go ahead.
Okay, all right. So I'm speaking from the patient side of things, the community side of things. On our side, we have actually planned trainings, SPCC trainings. We actually asked the implementers, the people who are working on the ground with patients, to ask them, do you know how to design messages that can change behaviors? Have you been trained in such a, have you had such a training? Do you have the capacity? What we found is that most of them don't have. So using that information, we looked at the gaps, and we've now developed a comprehensive SPCC training capacity building program. So we are going to be going from the national level, we are going to be going across all the provinces to make sure that all the people who are working with the communities, working with the patients, know how to communicate to the patients. They know the principles of SPCC. In that way, we hope that we can win at some point while they are training, capacity building trainings on quality improvement, on the facility processes and other things. We also want the same kind of quality in the communities and the communications that we're getting out to the people out there. So there's a plan to actually roll out these trainings nationally. And the hope is that we can win in that area as well.
Thank you so much for that response, Monica and Mr. Blood. I will latch on what you said in the latter, in terms of rolling out. Maybe taking advantage of this platform to say, Monica, Northern Cape is here, Northern Cape is always willing, and Northern Cape is ready, to even pilot the trainings. And we as a province definitely are in need of that. I think with the stark brief note that Mr. Blar gave us in terms of how we stand, our performance is not where it ought to be, especially with our big districts, Francis and ETG in particular, to a certain extent ZFM. Because if we can win, especially in one or two of those districts, we can surely make an impact provincially. And also, Monica, while we are at it, our province is so scattered, and we have vast majority of cultures here. So in our messaging, we are constantly getting requests in terms of translation, and we are struggling when it comes to do the translations from a provincial point of view, as we do not have the full capacity and resources at the provincial office. How can national intervene and assist us in terms of rolling out SPCC, getting the necessary messaging in the various languages that suit the different districts? Namakwa, you get Afrikaans, with ZFM, JTG, you get Tswana, English, and maybe a bit of Afrikaans. Francis Barrett is mixed, Pixley is also predominantly Sitosa. So how can you guys really, assist us to address those needs?
Yeah, thank you so much, Nati. I've heard about that concern across the provinces. And it's not just the language, but it's also about the images that we are including. People cannot relate, So we are trying to find a way of sharing with you open files that you can then just, in terms of messages, you can then just adapt them accordingly, customize them. So I'm currently trying to work out on branding guidelines, because branding for the department is a serious issue and it needs to be adhered to. So as long as we adhere to the branding guidelines and then the communications are all in order, it's uniform across the provinces and everything, you can adapt, like in terms of the brand CI. But yeah, we are trying to work on it, and soon we'll communicate on how that can be done. But we are expecting you guys on your side to actually do the translations, because you all know that resources has become a problem with the funding cut. So even at the national, we don't have the resources to do the translations. I can say, however, that we managed to translate a pamphlet which can be distributed in all the languages, in all is it 9 languages? I think 9 or 10.
Mm-hmm.
At least that one material, but it was expensive. It was an expensive process to design it. And so we have that one material that we could share across the province, but then some of these things need to be done there. We just need to give you the open files. I also see, can I just address, there's a question there that says, what is the role of civil society in TB?
Please go ahead.
Okay, all right. So there's no way we can do community interventions without the civil society. The civil society are the heart of the community. They are based in the communities. They are the people. It's where the people are at. We can sit at the national. We cannot decide what happens in the communities. So the civil society are actually the driving force for all community interventions. And I talked about the MyTB story. We cannot just have a platform. What about the people who cannot go on the website? How do they access it? What about the people who don't have phones? That's why I talked about the TB champions. The entity that would drive interventions, like the TB champions may tell, those who've got access may tell their stories on the website, but you also need them on the ground. The way they are inspiring hope on the websites, you also need them on the ground to be doing the same. And civil society will be the driving force towards that. So maybe in short, that's all I can say. It's the heart of the community and therefore the heart of TB SPCC as well. Thank you.
No, thank you so much, Monica, for that. I hope that it has been thoroughly answered. The role of civil society, we can't win this battle as government alone, because to a certain extent also we have our partners as well that we need to also constantly work with, and as a form of extension of the services the department has. But we are almost reaching the end of our life. I'm being flagged here and shown that we can't go on for another hour. I was hoping we could squeeze in another 30 minutes. But we can't. But please let me allow Mr. Brown and yourself again, Monica, any parting shots, any advice that you guys would like to share with our viewers in terms of TB and anything that you think they need to hear, Mr. B, and then Monica, you can close out.
No, thank you, Nati. Our viewers and the public out there. 3 messages. TB is curable. TB is preventable. Yes, you and I can end TB. Thank you very much, Nati.
Thanks, Mr. B. Monica, you can have your parting shots, please.
Okay, for me, I've got 2 key messages. Can you please do me a favor and go to my TB story? If you have a story to tell, if you've had TB before, if you've cared for a TB patient before, if you work in the TB program, can you please go to www.mytbstory.co.za and see if you can contribute there. The second one is we've got a self-screening app, which is currently available on WhatsApp. It was launched yesterday. And I think this is a good opportunity for me to share it with anyone.
Yes.
So what you do right now, if you're on your WhatsApp, get your phone, go to WhatsApp, save this number, 0600 123456. Simple. 060 060 0. So it should be 0600.
Yes.
Then 123456.
We
save that number.
We lost you there for a few seconds. Can you just your last part, just share it again?
Okay, 0600 1, 2, 3, 4, 5, 6. Save it as contact NDOH and go to your WhatsApp, start a conversation there, just say hi. And then you'll be subscribed there. You'll be getting all the alerts. All the messages we're sending out this month and every other month on TB will be there. You will also get an alert to screen yourself for TB, to know if you are at risk. It will tell you at the end of the screening, it will tell you whether you're at risk and need to go to the facility to test, or if you're fine, but it will also tell you what to look out for and what are the things that you can do to prevent yourself. So that is a very important tool that you can use by yourself. If you're not sure whether you have TB or not, or maybe you're coughing, you feel like maybe I could have TB, get on the WhatsApp, talk to Contact NDOH. You'll get there, you'll find the TB check there. There will be an alert that will take you to where you can do the screening. So for me, if you do those two things for me, I think I'm going to be very happy. Thank you very much.
No, thank you so much, colleagues. Thank you so much, Monica. We will definitely, as the Northern Cape Department of Health, also be embarking on our various social media platforms to ensure we disseminate, promote, and market, TB messaging and that platform of My TB Story.
I'll send you the material, Nati. I'll send you the assets for that you can share on your websites, because we just launched it yesterday. Thank you.
No, awesome. Thank you so much. And there we have it, colleagues. Time flies when we speaking TB. I'm hoping, I'm hoping where we are breathing easy. We are not struggling to breathe. We take it for granted, Mr. Blar, that we are not using ventilators to breathe. But yet, TB affects our ability to breathe independently when our immune system becomes compromised. So, colleagues, the messages that were shared to our viewers, please don't be hoarders of the information. Please share the information with those close by, your family members, friends, and colleagues. Ensure that you are also following the Provincial Department of Health, Northern Cape, social media platforms on Facebook, Instagram, YouTube, Twitter even, and WhatsApp platform and TikTok as well. So we are moving with digital times, Monica. I keep pressurizing my communication colleagues in terms of TB messaging, and they are somewhat adhering to counseling. But with that being said, let me share that the Northern Cape Department of Health is having various district TB build-up activities right across the province. So from wherever you are, Namakwa, Pixley, Francis Bar, ZFM, please be on the lookout and see where we are. Come visit your nearest facility, do testing, screening. It's absolutely free. And yes, as Mr. B said, let us breathe easy. And remember, you and I can end
TB.
Thank you so much, colleagues. Have a blessed night. Thank you, colleagues, online as well.
Thank you.
Thank you so much, Nati, for having us.
Thank you, Nati.
Bye.
Bye.